Hello, everyone. Thank you for joining us. Welcome to the 2020 Hot Topics in Environmental Law Summer Lecture Series brought to you by the Environmental Law Center at VLS. I'm Jenny Rushlow. I'm the Director of the Environmental Law Center and Associate Dean for Environmental Programs at VLS. And I apologize for the late start. We are surviving some tech issues. I'm going to bring up a list of resources on the screen to direct you to some of our programs at the Environmental Law Center for those of you who are looking to learn more. And you can also view our full Hot Topics lineup by going to the website vermontlaw.edu/hot-topics. Each talk is worth 1 CLE credit in Vermont, so please keep track of which talks you've attended if you'd like to get those CLE credits. And there will be time for Q&A at the end of the talks today, so please type your question in the chat box at any point during the lecture, and we'll get to as many of them as we can. We have 2 speakers today, and I'll introduce our first one now. First, we have Dr. Kristen Cooksey-Stowers, who is an assistant professor in the Department of Allied Health Sciences at the University of Connecticut. She has an interdisciplinary background in health equity, agricultural economics, public policy, and medical sociology. Her program of research focuses on reducing inequities in diet-related health outcomes by improving macro and micro level food environments through sustainable policy solutions. She conducts community engaged and mixed methods research to examine the impact of food swamp environments on racial, geographic, and socioeconomic disparities in diet-related health outcomes, the potential of inclusive public policy processes to prevent disparities in diet-related health status regardless of racial and ethnic minority and citizenship status, as well as the influence of micro-level food environments like food pantries and family childcare homes on health risks in food insecure populations, communities of color, and other historically marginalized groups. The talk that our speakers will present today is called Healthy Food Access Policies and Prioritizing Equity Amidst the COVID-19 Crisis. Please join me in welcoming our first speaker, Dr. Kristen Cooksey-Stowers.
Can you all see my screen? Okay. Thank you so much for having me today. And thank you to Jenny for your introduction. As Jenny mentioned, my name is Kristen Cooksey-Stowers, and I'm an assistant professor of health disparities at UCONN. Today, I'll be discussing food access and COVID-19 through an equity lens. And just to provide a roadmap of my presentation today, I'll start with a bit about my professional background and research interests very briefly, since Jenny was so thorough in her introduction. Then I'll walk through a few key terms and frameworks that shape my thinking and research around what it means to focus on equity in the context of diet-related health and policy. Afterwards, I'll share key findings from one of my earlier studies on the relationship between food swamp environments and obesity disparities in the US, plus COVID-related implications. And last, before turning it over to my colleague Amanda Karls, I'll end with highlighting 2 empirical studies I conducted exploring viable solutions to mitigating the impacts of inequitable neighborhood food swamp environments. So just briefly to highlight my background, as was mentioned, I come from a very interdisciplinary perspective, including an agricultural economics background from University of Illinois, training in public policy and public health at Hopkins while working at the USDA Economic Research Service. Before I went on for training in public policy and medical sociology at Duke University. And prior to transitioning to faculty at UCONN, I trained in food policy and community-based research as a postdoc at the UCONN Run Sitter. And so all of this has sort of accumulated into this research agenda and focus of mine that has equity at its core and focuses on issues such as food environments, food insecurity, and food banking, the prevention of diet-related health illnesses, land use zoning, and public policy. But what is health equity? It's a term that is often misunderstood and misused. In fact, Dr. Braveman and colleagues define it as the principle underlying a commitment to reduce and ultimately eliminate disparities in health and its determinants, including social determinants. So while health disparities and health inequities are related, they're not necessarily synonymous. And in the health equity space, we have this sort of call to action in a North Star, if you will, as a way to keep us accountable and consistent in whether we are actually doing health equity research. And that, and I thought this quote captured the sentiment very well. And it is, if an effort does not address poverty, discrimination, and their health damaging consequences for groups of people who have historically been excluded or marginalized, it's probably not a health equity effort. We also have this critical principle of first do no harm in health equity, which this captures nicely. Without careful design and implementation, policy interventions, systems, and environmental strategies can inadvertently widen health inequities. And this idea was vitally important prior to the COVID-19 pandemic, and it's even more essential now that the policy systems and environmental COVID-19 responses avoid making pre-existing inequities worse. So many of you have probably seen this visual of what it means to think about equity in our policy work and food environment research. But I want you to think now about this fence as barriers to optimal health, and the boxes as resource allocation in terms of policy focus, funding, research, advocacy efforts. The issue of quality, or the term equality, prompts us to think of what's fair in our allocation, or even, regardless of whether or not we actually achieve populations overcoming this fence, these barriers to society and optimal health. Equity, though, is about meeting people where they are and intentionally allocating resources, broadly defined, so that everyone overcomes societal barriers to achieving optimal health. Ultimately, we want to get to this idea of liberation, where optimal health is obtainable for all, and there are no sort of social barriers to achieving that. But this figure is sort of a call to action for our current state. This is our existing reality, that we have historically oppressed people, further marginalized, and resources continuously allocated to already privileged populations. The social determinants of health framework includes neighborhood built environment, health and healthcare, social and community context, education, and economic stability. And I just include these blue boxes to indicate sort of where I view my research as being situated in this framework. And so not necessarily proclaiming to be an expert of all, but these are where my research topics sort of align with the framework. The social determinants of health framework offers us a systematic way to mind map which specific aspects of the social experience, both individually as determinants and in combination with each other, which might present barriers to optimal health and thus perpetuate health inequities. For example, in reference to economic stability, we saw that food insecurity and job loss pose huge challenges for families' ability to even adhere to public health recommendations to stock up on 2 weeks worth of food at a time. This World Health Organization framework at a more macro level can help guide us into how to act on addressing determinants of health inequalities. And it not only highlights, as you see in the socioeconomic position column, it not only highlights class, income, gender, and racism as structural determinants, but it also points to policy at the highest level as upstream determinants, policy, governance, and culture, societal values, as important factors to keep in mind and even leverage as we try to design and evaluate policy and legal interventions, as well as understand the impacts of the COVID-19 pandemic. And I highlight in red here my focus on food environments and neighborhood availability. But my research has focused on this relationship between these issues at the food environment level downstream and how they interact with upstream factors like policy, space, place, and race. As many of you know, the USDA defines the food desert as a low-income census tract where a substantial number of the population is low income and has low access to a supermarket or grocery store. Few of you may have heard of the term food swamps, which are described as areas where fast food options or unhealthy food retailers inundate healthy options. So this idea of food swamps is about relative exposure, right? Holistically, what is the quality of our food environment as a whole, rather than one food outlet at a time. I published a national study looking at food deserts and food swamps and their impact on adult obesity disparities. So the primary research question for the study was, what is the effect of food environments characterized as food swamps on adult obesity? Because there were measurement challenges of what a food swamp environment even meant in terms of the science, I aim to contribute to those measures and, using a quasi-experimental approach, explore the relationship with obesity disparities. One of the things that I set out to explore was whether food swamp environments were the same environments as food deserts. And as you can see, just from a spatial standpoint, where we have on the left food swamps in sort of dark red and orange, and on the right, we have food deserts also in red and orange. There is some overlap, but they are appearing to be separate phenomenon. And the black lines going through the food swamp map are actually our highway exits. And you can see that there's a close relationship between our inequities in our highway system and the food environment. So just sort of briefly to highlight some of the key findings, food swamps are a separate phenomenon from food deserts. They're a stronger predictor of disparities in obesity than food deserts in the study that I conducted. When we thought about the relationship between food swamp environment and transportation environment, the food swamp effect was stronger in areas where the population was less mobile. So were areas where the public transportation was limited, there was low vehicle ownership and things of that nature, the impact of food swamps on obesity was much higher. And because we often come up on these conversations of, is it really an environmental issue? Is it more about income, right? Is it more about just giving people more money and they can move and live in better environments? Well, when we accounted for income inequality using the Gini coefficient, we found that that did not explain away the food swamp environment phenomenon. So while income inequality is absolutely a concern in the United States and an issue that we should continue to work on, it does not explain away inequities in our built food environment. It is a separate issue that warrants attention. So as these headlines, or through this research, I was able to engage in national discourse around Black and Latinx communities' disproportionate exposure to food swamps and other types of inequitable food environments, evidence-based approaches to identifying food swamps areas at the neighborhood and census tract level, such as in the case of New York City, who was looking to identify at the zip code level where their food swamps were so they could prioritize them in terms of policy response, and was even able to engage in conversations around equity and food-oriented city planning. So in terms of COVID-19, as these headlines indicate, racism in the food system has become a critical issue and topic in light of the pandemic, where families have been forced to quarantine or even work as essential employees in suboptimal environments in terms of health and safety. I had the pleasure of being interviewed by one reporter who wanted to explore the role of food apartheid and economic inequality in what we're seeing in terms of higher rates of COVID-19 infections and deaths among Black and Brown Americans. And drawing from my research on food swamps, food insecurity, and inequitable health risks, my primary concern in all of this has been the stakeholders that perceive food policy, nutrition, and diet as a separate issue from the COVID-19 pandemic, when in fact, our bodies are trying to fight off illness and living in an area where all that you can get to and afford is high fat, high sugar, high salt products, like in the case of food swamps. It's a serious challenge, particularly going back to this issue of relative balance, where when these food options are in greater abundance than nutrient-dense foods that in fact build our immune systems and support our health, that's a serious problem. And as we know, individuals with pre-existing conditions like diabetes and hypertension are in COVID risk, and people of color and individuals with lower income went into the COVID-19 pandemic being more likely to have those underlying conditions. And so just to comment also sort of cumulative barriers from a social determinants of health framework, for Black Americans in particular, the last few months have sort of had this combination of racism across systems, including food and the criminal justice system. And all of this in light of cumulative barriers with COVID-19. The recent murders of Black Americans like George Floyd and Breonna Taylor prompted racial tensions in Black Lives Matter demonstrations around the world. One article highlights how on the south side of Chicago, where I actually was born and raised, some south side neighborhoods have been devastated, leaving people even less able to obtain food and medicine that they need. So a shock to the system at the neighborhood level, both in terms of a healthcare crisis, as well as a criminal justice crisis and social justice crisis, and lacking food. Like many places, the city was already plagued by the dual burden of lacking supermarkets and an overabundance of unhealthy food retail in Black and brown neighborhoods. Grocery stores and Walgreens that were built with produce sections in response to food deserts being identified under the Obama administration were destroyed and burned down in recent months in light of the racial tensions in Black Lives Matter, leaving fast food and carryout places as the community as the only food store options that the community had. So as we have heard time and time again, the COVID-19 and recent racial tensions have really put in the forefront inequities that exist in the United States, but these are not new inequities. These shocks have widened gaps that were already there. For the remainder of my time, I'd like to briefly highlight two studies that I conducted on solutions to inequities and racism in the food environment. The first study is part of my work with the Healthy Food Policy Project titled Tackling Food Swamps Through Legislation, a case study of the Food Equity Council in Prince George's County, Maryland. So just to provide some background about their work, they established what our team has called a multi-pronged policy approach to tackling food swamps. They addressed supplemental SNAP to health work at farmers markets. They established an urban agriculture tax credit. And when they saw that the populations that they wanted to promote the tax credit to, they actually couldn't access it because of the definition of urban farming in the county, they went back and redefined that. From a policy standpoint. The Food Equity Council was also part of healthy vending standards on county property. So they set standards on the proportion of products sold in the vending machine, as well as setting some standards on stocking positions. So where healthy or unhealthy food products were placed at eye level or not. For example, there's a lot of research in terms of behavioral economics and nudging in terms of how do you place a product to promote folks to select it. And they also manipulated pricing. So unhealthy food options could not be less expensive than the healthy options in the vending machines on government property. The other thing that they set out to do as part of their strategy was zoning. So restricting new fast food establishments in what they called high health disparities index areas. So in public policy, we have the multiple streams framework for understanding how policy comes about. And so briefly, the idea is that there are three streams, that you always have a societal problem, that there are always these policy tools, right, that can be leveraged to address a policy problem, whether it's regulation, things of that nature. And you always have politics at play. You always have differences of opinion, political parties, things of that nature. The idea for this framework is really this policy window, that policy is passed when these three streams align, and what they sort of like magically describe as this policy window, when all the three streams align and a policy is then passed. So we applied this framework to try to understand what happened in Prince George County in their Food Equity Council as they've set out to address food swamps. So the questions were, in what aspects of the policy process was this Food Equity Council particularly effective? And did the Food Equity Council face any barriers when attempting to translate their food equity values to policy and practice? So just to highlight a few key findings, the Food Equity Council played a key role in the politics stream in particular because of their ability to leverage and their viability with community leaders and residents. They were well respected. They were not embedded in the local government, but nationally or locally acknowledged to be the Food Policy Council of the county. They were an asset to policy champions or elected officials sitting on city council in the process of coupling the streams of what the policy problem of food swamps that they saw and particular tools that they could use to address it, SNAP to health, vending standards, things of that nature. They demonstrated great variability in identifying resources to fund the implementation of their policy. We also noticed that they were not typically a major player in defining the problem. They set out to address inequities in the food system because of some research and reports that had already come out about there being sort of a food apartheid issue in the county. In their case, the barrier was sort of the inner beltway, for example. They were less effective at being agenda setters because they were independent of the local government, and they demonstrated disparate levels of engagement in the process of identifying viable policy tools. So COVID-19 happened after we concluded our study with this Food Equity Council, but we stay in contact. And based on my recent conversations with the FEC of Prince George County, Maryland, I want to share that in light of COVID-19, they quickly switched their emphasis on establishing a produce prescription program to food insecurity and emergency food response. Just to provide some examples, their COVID-19 food assistance resource guide has received over 37,000 hits. They coordinated donations from the World Central Kitchen to county partners, resulting in over 10,000 meals served weekly. They convened over 70 food assistance providers supporting organizations through biweekly Zoom calls to share best practices and resources in light of the COVID-19 response. And they coordinated bulk purchases and donations for food assistance providers at a varied scale, ranging from 10 turkeys from one resident to delivering 2,000 pounds of turkeys from a farmer's coop in Virginia to feed 1,000 residents. And so the Food Equity Council in Prince George's County is just one case study, right? But they're certainly not alone. We see this critical role that food policy councils are playing across the country to address COVID-19. And this is just the link to a video that the Johns Hopkins University Center for Livable Future recently released, highlighting the work of food policy councils in Iowa, Detroit, and Montgomery County, and particularly work that has focused on reducing hunger or food insecurity, supporting farmers, and protecting essential food retailer workers. So for the sake of time, because we had a bit of a late start, I won't show it here, but we'll share the slides in the link. The second study that I wanted to share focuses on tailoring health communications and how that can improve community of color support for different types of food policies, in this case, zoning restrictions. And the Healthy Food Policy Project, our team has talked a lot about authentic resident engagement in the policy process lately. And so I wanted to sort of share this topic as well. Since this study is particularly focused on fast food zoning restrictions, I'll start with a bit of background information. It taps in closely with the issue of racial residential segregation, which scholars have described as two different Americas that are created because of inequality in neighborhood design and how land is used. One of my favorite quotes from the environmental justice literature and equity literature comes from Dr. Yinka at Drexel, who said, "What is seen, asked, and heard depends on who is looking and listening." So framing matters when we're describing our policy interventions to the community. And yet little is known about how the public perceives fast food zoning restrictions. So to address this gap, I set out to find out the impact of different framing messages on increasing support for fast food zoning, and wanted to explore race and ethnicity as moderators of these framing effects. I conducted an online experiment manipulating these frames. It was a between subject experimental design, meaning each participant only saw one message of the proposed policy. And I used two samples combined together of US adults and reached over 4,000 adults. So here are the particular frames, right? The idea is the policy tool is the same, right? To restrict fast food zoning, to restrict fast food establishments by area, but just to manipulate how this is framed or messaged to the community. So I had a nutrition frame, which is often the frame used in communicating these types of tools, or had been historically, focusing on child nutrition and value to child health and diet, benefits to the economy in addition to diet. This idea of addictive food properties, right, which is very sort of anti-American in the sense that this idea that the way that foods are composed could prompt you to eat them outside of your control, and a race equity frame. So this idea of fast food zoning being a way or tool to address fast food companies' unfair marketing practice in Black and Brown neighborhoods. And there were several different zoning policies that participants saw, quotas and bans, conditional use permits, requiring minimal distance requirements from youth facilities like schools and playgrounds, limiting vehicle access and curb cuts, prohibiting the distribution of toys and promotional games, which is a performance zoning tool, and offering tax breaks and subsidies to incentivizing fast casual outlets to coming to an area. And then also just wanted to flag that when asked their perception of how culpable the fast food industry was in the obesity epidemic, over 60% of respondents indicated quite a bit and a great deal. So just to, tap into how this national sample of U.S. adults were perceiving the fast food retail, the fast food industry's role in all of this epidemic. So just to recap the findings from that study, health communication and marketing professionals and advocates should employ marketing strategies considering policy type and racial composition of the community. So when we're trying to address health disparities and promote, maybe even mobilize the community around a specific type of policy, we want to be conscious of the type of tool we're talking about, as well as the racial composition. So going back to the quote that I read before about it depends on who is looking and listening, right? And there's all of the historical aspects of land and what that means to Black Americans, and culturally what child health means for certain groups. So we did see significant differences in how different frames were perceived by policy tool. One thing that stood out was that the nutrition and equity frame was almost a universal frame, which we expected for the racial ethnic minorities in the population, but across race and ethnicities, the equity frame was particularly effective in increasing support for the policy tools. And I also wanted to highlight that there were racial differences in support for the child, for youth-related zoning, right? Restrictions from schools, near schools and playgrounds, for those in the child nutrition condition, and for the Latinx subpopulation in the study, the nutrition and addictive food property frames were particularly helpful. So in summary, in terms of food access and COVID-19, the issue is absolutely equity. On the topic of inequitable food swamp environments, they are a stronger predictor of disparities in obesity prevalence. They're important neighborhood contexts to address when we're designing policy systems and environmental strategies, targeting obesity inequities and future and emerging inequities related to COVID-19. They can be addressed through local policy bundles, not only addressing an increase in healthy food, but also addressing the disproportionate exposure to unhealthy food retailers. In partnership with equity-oriented food policy councils like the case study in Prince George County, and with evidence-based health messaging tactics to maximize resident engagement among historically marginalized population. And with that, I'll end. Thank you so much, and I'll pass it on to Amanda Karls, my colleague.
Kristen, thank you for really setting the stage and helping us start to think through what some of the really important issues are around food access and equity, and sort of just not just food access, but also how important it is that food be not just affordable and available, but also the quality of food that's available, and how important this is during this specific time when we're encountering this unprecedented pandemic. So before I jump in, I should just introduce myself a bit. My name is Amanda Karls. I actually, because we had some technical difficulties at the front end, I'm not sure how much introduction I got, but I'm a staff attorney at the Public Health Law Center, which is located in St. Paul, Minnesota at the Mitchell-Hamlin School of Law. And that campus is located on the lands of the Dakota people. I'm going to show you quickly here just a picture of our team. We're a team of attorneys, policy analysts, and other professionals who work nationwide on public health policy issues to help prevent and reduce chronic diseases and promote health equity. I am going to have to give sort of a abbreviated presentation today, so bear with me if I'm speaking fast. I'm already kind of a fast talker, but I know we need to get to kind of wrap this up around quarter to the end of the hour so that there's time for some Q&A. So I'm going to try to go through this pretty fast. So as part of my role at the Public Health Law Center, where again I work as an attorney, I focus some of my time on legal analysis for the Healthy Food Policy Project. Kristen and I are part of. And the Healthy Food Policy Project is an online resource that identifies and elevates local laws that seek to promote access to healthy food. It's a multi-year collaboration of the Center for Agriculture and Food Systems at Vermont Law School, which of course is our fantastic host here today, and a shout out to them for taking the time and energy to highlight this particular topic. It's also a collaboration with, again, Public Health Law Center where I work, and then the Rudd Center for Food Policy and Obesity at the University of Connecticut, where Kristen is located. And the project is funded by the National Agricultural Library Agriculture Research Service at the U.S. Department of Agriculture. When the pandemic took hold, we were able to shift some of our energy into specifically capturing local policies that facilitate food access during this very specific time, as well as other emergency periods. And I'm going to be talking with you about that today briefly. But of course, local level policy is just one of the areas for improving food access. In addition, there is certainly federal government action where we can see legislation such as the Families First Coronavirus Response Act and food program adjustments and other regulatory responses from various federal agencies. And then of course, there's also action that can be taken by tribes as well as by states. And certainly many are doing so in response to the pandemic and specifically in response to food access and hunger relief related issues. But for purposes of today's discussion, just because in part Kristen has teed it up so well, and because it is the focus of the Healthy Food Policy Project, which is that project that we both work on, I'm really going to be talking about, sorry about that, I'm really going to be talking about local policy options that have emerged during the pandemic. But I do also want to point out that the Healthy Food Policy Project, and you can see that up on the screen right now, includes several other resources. So we have, as I will be talking about it in a bit here, gone and built out an index of local policy responses to food access specific to the pandemic. But we have a variety of other resources on the website, which is healthyfoodpolicyproject.org. And I would really encourage you to check it out because, of course, food access is going to be an ongoing issue well after the pandemic is over. So those of us that are working in public health and food policy, have been focusing on many of the same challenges before the pandemic that continue to be problems. But of course, as Kristen has highlighted, many of them have been exacerbated by the pandemic. So in my home state of Minnesota, we already had high rates of food insecurity, where 1 in 10 Minnesota households were considered food insecure before the pandemic started. And when we talk about food insecurity, we're talking about the state of not having reliable access to enough affordable, nutritious, culturally appropriate food. And that, of course, is associated with poor health and increased medical costs in both children and adults. And rates are worse, particularly for BIPOC communities. And it's only going to get worse, as we see from reports coming out from reputable sources, such as Feeding America. So it's just, I think, really important, more now than ever, that we be thinking about how we continue to address this important issue and how policy can provide part of the solution. So, and I'm just getting a note here that I can maybe take just a little bit longer than quarter to the hour. So I'm going to indulge that and just dive into this a little bit more here. So what you're seeing right here is part of a snapshot of our COVID-19 food access policy database. So the index includes formal municipal policies that accelerate, prioritize, or facilitate food access during the COVID-19 pandemic and other emergency periods through measures that exceed ordinary non-emergency time policies and or specifically prioritize health and or equity considerations. And actually, let me go back to that slide. I'm just going to point out that this is a sort of a screenshot, and actually I'm not sure exactly how it's focusing in because we're using this technology a little bit differently than it would normally appear on my PowerPoint. But the point is, there is a downloadable index that you can sort and filter. So you can sort by policy type, you can sort by state or local jurisdiction. And then there's also a summary of each policy, a link to the policy. And I would encourage you to go on the healthyfoodpolicyproject.org website and sort of play around with it to get a better sense of what is all included. But I think it's also important to talk about what we're not including, just so that there's no confusion. We are not including school district policies and most other special board policies, just because it's not within the scope of the project. But it's, of course, I would be remiss not to mention the fact that school districts have played an immensely important role during the pandemic. We've seen them coming out with local policies to address food security, particularly for student populations, and as well as sort of the birth to pre-K space. We also do not, in this particular database, include policies that merely define food establishments like restaurants and grocery stores as essential businesses, or otherwise allow them to operate without modifications amid other business closures, unless they specifically emphasize services for priority populations or access to fresh foods. When I'm talking about priority populations, I think it's kind of important to just define that term of art as we use it for this project. By priority populations, we mean groups with unique healthcare needs or issues, as well as groups that tend to be socially disadvantaged or marginalized. And you might hear me continue to use that term as I go through these next few slides. So just at a very high level, types of laws that we've identified as we've been looking at what cities, counties, and theoretically towns, though we're not seeing a lot of that, are doing related to the pandemic. Things sort of fit into these 5 big buckets so far. We're seeing food supply chain and procurement laws. We're seeing food support policies. We're seeing laws that prioritize fresh food, food cultivation, hunting, or fishing. We're seeing protections for food procurement for priority populations. And then we're seeing some special exemptions and operating allowances for food establishments. So kind of just really quickly give you a few examples here, and I'll try to keep this high level again so we can wrap up. Within the supply chain and procurement law kind of category, We're seeing things, for example, where you'll have a mayor for potentially coming in and issuing an emergency order to go ahead and freeze prices or ration or otherwise provide quotas or other distribution and sale controls around food to make sure that it's hopefully equitably distributed throughout the community and there isn't, sort of hoarding and price gouging. And there's an example up here from Champaign, Illinois. You also see things like what's being done here in this example from Atlantic County, New Jersey, where, local government might try to cut out some of the red tape that might normally happen around government contracting to facilitate food procurement during this period. Another area we're seeing are food support laws. So laws that help people purchase food by providing special benefits or other formalized efforts to provide food through things like meal services and food distribution efforts. And so within sort of that space of funding for food, one I really want to call out is the Seattle, Washington ordinance. Why I'm calling it out is because although what we're really looking at here are mostly very reactive laws that are dealing sort of like with how to address this issue very immediately given what's happening during the pandemic. Seattle, Washington was able to do something pretty unique because they had already had in place a sugar sweetened beverage tax. And so, before the pandemic. And so they were able to take several $1 million from that fund to create a new $5 million grocery voucher program, which is pretty fantastic. So it's kind of an interesting example of how localities might be thinking proactively about what they could do to sort of set aside rainy day funds using other public health measures that might end up supporting unanticipated needs. Also, we've got laws that prioritize fresh food, food cultivation, hunting, and fishing. Of course, these are important laws to sort of help protect food sovereignty and sort of self-sustainability, as well as just to make sure that the laws that are, or the efforts that are being prioritized really are making sure that people have access to that fresh food. One example here is from Anchorage, Alaska. It's not a very actually atypical order. This is one of those orders where there had been, I think actually in this case, potentially both statewide and citywide orders regarding certain closures, but there had been an exemption to say that, certain activities, including fishing, hunting, farming, were allowed to continue even though other businesses and activities were ordered to suspend. And the reason I just call this out just more because I particularly like the title of the hunker down order instead of a stay-at-home order, just because it seems to feel a little more, I suppose, cozy during what had been happening over the spring and late winter months. So I'm just about at the end of my time, but I'm going to try to quickly go through this here. We've also found laws that talk about priority population food procurement protections. Here's an example here from Los Angeles, California. These are really, I think, the ones that are going to be very, very important during this time. So I hate to give these short shrift, but given time, I'm going to skip through to the next slides. Lastly, in these buckets, there are special exemptions and allowances for food establishments. So things that try to make it easier for food businesses to operate during this time. Just a few things to highlight here. Certainly this is just the tip of the iceberg. There is so much more that localities can and should be doing as the pandemic continues. I've got just a few ideas here highlighted on the screen. One that we've sort of seen recently that I think is important that I would love to see other municipalities adopt is an example from Fresno, California. That one is a law that supports ongoing senior hot meals programs, but it particularly requires the information in the ordinance to be translated into commonly spoken languages in the area, and those would include Spanish, Hmong, and Punjabi. Another thing that I'd really like to see, and I'm hopeful to see happen, it sounds like there's some effort in New York, is to have laws not only just be thinking about sort of this general food access idea, but also how do we make sure that there are certain nutrition standards around the food that's being provided so that we can ensure that people are really nourished during this period. And then just, I'm going to throw up a few other resources here for those of you who are particularly interested in understanding more about what is going on at the local level with respect to policy. Won't have time to click into any of these right now, but we will share these slides and you'll have an opportunity to do so at your leisure if this is something you'd like to explore more. And then also want to just point out, there's of course an important issue of preemption, which is something that is really, it can be very inhibiting when it comes to local public health policy. It's something that clearly I don't have time to talk about right now in great depth, but I'm just sharing this resource with you here so that you can understand what it is, and at a high level, just explain that preemption occurs when there's a higher level of government, such as a state or federal level of government, that eliminates or reduces the authority of a lower level of government, such as a city or county, over a given issue. And I'm sure you can all think through sort of like what some of those implications might be. But again, I encourage you to think through that topic, especially those of you who are practitioners and soon to be legal practitioners. And with that, I'm going to turn it back over, and I'm sorry we don't have more time for Q&A, but hopefully we can take a couple questions.
Great, thank you. Yes, let's jump in our questions. So our first one is there a known example of a community that has enacted any of these policies that's seen measurable health benefits, or is everything still too recent to draw conclusions?
I'll quickly address this and then let kind of Kristen do a follow-up on it. But, I think with public health research, these things usually take sometimes in the order of years to fully understand how effective they are. And so I'm not aware of anything currently, but I would be surprised if anyone was able to sort of like quickly quantify metrics around these. We're kind of flying by the seat of our pants as we do these things. But yeah, Kristen, if you have further information on that, I welcome you to help extrapolate.
Yeah, I would say your instinct on this is right. It just really I feel like the research field of this around food nutrition and food insecurity and food policy is scrambling constantly. We're having conversations on how to best get real-time data to assess what's happened. And so I think in terms of, immediate response perspectives, like from a process evaluation standpoint, like how are things going, the feedback from the community, those kinds of conversations are being had, particularly for the impact of food policy council work. Like the Center for Livable Future has done a nice job of convening food policy councils to have stakeholders speak about their experiences and like the feedback from the ground. But in terms of like statistical data analyses, to Amanda's point, the data is just not there, and we're several months out from really seeing that type of evaluation come out.
Okay, great, thank you. There was a reference in Kristen's talk to the cumulative effects of lack of food access and COVID and other negative health outcomes. Are there any lessons learned from those public health policy approaches to cumulative impacts that the environmental movement might be able to learn from a policy standpoint?
Well, I think it kind of ties back into the previous question in terms of best practices and like assessments of impact. We can't speak to that just yet, but I would say, as you saw in my comments, in terms of drawing from, environmental movements, the environmental justice area, there's certainly an opportunity to leverage all of these movements happening at once, right? The public response to COVID and the folks that had never thought about inequities and disparities and health disparities in particular before, aligned with this huge national movement and sort of focus on injustice in the criminal system, what it means for the police to kill unarmed Black and brown folks. So rather than these movements and efforts to mobilize happen in isolation, I would say the opportunity is for them to leverage one another and be coordinated. I don't know that we can speak to the impact of that, but the fact that they're happening simultaneously, yet the stakeholders and advocates are typically isolated, I think actually minimizes the overall impact for sustainable long-term change.
Okay. And the policies that were discussed today are largely municipal in nature. Can you speak to the role of the federal government or even state governments in the policy changes that you're looking for?
Kristen, I don't know if you want me to take a stab at this first too, but so in terms of like what is currently happening at the federal level, I'd mentioned some of this. We're seeing a fair amount of funding coming out of the Families First Coronavirus Act, which is of course federal level legislation, and flexibility being given to federal agencies, including U.S. Department of Agriculture. And with that flexibility, they've been able to make some adjustments to some of their food programs, and also to provide some additional emergency food support. I think there's, of course, additional flexibility needed. There's additional consideration needed as to how this is going to play out long term, and to be thinking through, for example, some of the changes that the federal government has recently tried to make around accessibility of SNAP benefits for able-bodied working adults, and to do a hard look sort of at what's going to be needed going forward to make sure that food continues to be an available resource for all people in our country, especially those most impacted by food security, which, as we've already mentioned, really has impacted BIPOC communities in a very significant way.
Mm-hmm. And just to piggyback off of that a little bit, obviously on the topic of food insecurity in particular, we know that SNAP and TFAP and these type of programs are a critical, aspects of the policy context. And obviously, there were actually pre-existing differences at the state level on how well folks were getting or the states were getting SNAP benefits to those that pre-qualified, right? So I think there's this perception that though the federal government is the oversees the SNAP program, there's actually a lot of state sort of decision making that can go into that, right? So where a state lands on what they do for people previously convicted of felonies, where they land on, where their vehicles count against folks as assets, just when they screen for eligibility. There's a lot of state differences there, and so you see that the increased need and lags in response in distributing food assistance benefits only exacerbated in the current climate. So that's a key piece. The other part is a lot of the policy response that I focused on in terms of zoning. That's largely in the municipality wheelhouse. But as Amanda talked about, we have the threats of preemption, where, as you can imagine, all of this local response to COVID, I think, a huge player quickly responding to the local needs. If there are in a state where there's any, preemption of their ability to exercise those powers, that is a huge issue. That would have been a huge issue, and particularly could be, for zoning, for COVID responses. So yes.
Okay, great. Thank you for those answers. We are out of time, and so we'll wrap up today's talk. Thank you again to Kristen and Amanda for your presentation. And thank you to our viewers for joining us today. Our next Hot Topics talk will take place on July 28th, and we hope to see you then. Thanks, everyone.
Thank you.
Thank you. Take care. Bye.